in terms of suicide prevention, the field is a very white field. So what we are trying to do is to create spaces for people of color, Black, Indigenous, and people of color to speak, from their communities to be able to create more effective suicide prevention strategies. All the data tends to be 2 years old. All the data is not, I don't think, reflective, particularly in communities of color where suicide is so stigmatized that the reporting, I would say, is probably erroneous in certain ways. So, but we do know that there is not enough attention or resources paid to communities of color across the board. It is not a one size fit all kind of situation. So if you're going into the Asian American community, for instance, which is where I've done a lot of my work on mental health concerns, you say mental health and people are running the other direction. So we want to make sure that whatever approaches we have, are culturally sensitive, culturally appropriate, and fit the community in which you're working.